Okay. Welcome to What is Healthcare? My name is Eric, and I am your host and the creator of whatishealthcare.com. Also, whatishealthshare.com, because I love to talk about health shares. But today we're going to talk about something different, slightly different. I actually have created a 12-week series of shows that I'm going to put together. This is kind of my first attempt at a series like this. I have to hold my mic up to my face because I don't have a good enough mic yet, and this is all brand new to me. So I'm just doing things not necessarily on the fly, but just kind of learning and growing. But I've been sharing, health shared content and working with people for years now, and I figured it's time to start doing something about that. So here I am. I'm gonna share our first week's topic with you. First week, we're going to talk about why health insurance is not healthcare. And it's going to be a fun little conversation we'll have together. I'm going to go through a few things and points that relate to why health care is not the same as health insurance. And so let me jump into that. And let me share my screen here. So as you can see, I asked ChatGPT to say, hey, you know what? Give me a good little you know, visual of what this topic is about and why health insurance is not like healthcare. And it came up with this after my notes, but health insurance, of course, financial coverage, pays for medical bills, managed by companies, medical services on the healthcare side, diagnosis, treatment. We're going to talk about these topics, and I'm going to put this in a post on my website, so you'll find that there later. But for now, you can come to whatishealthcare.com and you can find all sorts of great information and resources right here about primary care services that are alternative to what we're used to, health share, uh, and some potential insurance related products, but mostly for the state of Utah, which is where I'm based. But all these other services are in all 50 states, so if you're anywhere, you can take advantage of these. There are some exceptions, of course, to this. And then I also want to caveat this that HealthShare is not insurance, not to be treated or uh, seen as an insurance product. It's not insurance. It's very different than that. But anyway, let's get back to our topic, shall we? So why health insurance is not healthcare? Let's talk about that. You know, eh, um, so let's see. So this series really is this is the first of a series of videos that I put together, or I will be putting together over the next few months, and hopefully you'll get a chance to see all those. But health insurance is not healthcare. They are not the same thing. They don't do the same job, and um, confusing the two really is what costs families time, money, and peace of mind, right? So a lot of people think that because they have insurance, that they're going to be taken care of, and that's not the case in most situations, right? There's still other things that you have to jump through, hoops that you have to jump through. Sometimes there's large amounts of money that have to be paid out for deductibles in order to qualify for the insurance to come in and pay some of those bills, and then you're still left holding 20% or whatever the insurance says, right? And so if you've ever been surprised by a medical bill, you know what I'm talking about, right? Or denied care or something that you thought was going to be covered, but it wasn't. There's and then even when you're at the doctor's office, like, you go in, they ask for your insurance card, and then you're left wondering, well, what's next? So it's not a crazy idea, but a lot of us get it wrong in that sense, where we think that because we have insurance, we have medical care. Well, we're going to talk about that and what we can do to fix some of that. So um, let's talk about some of the terms, the terminology, right? And so um, in plain English, healthcare is, and this is really simple equation, right? So healthcare is receiving diagnoses, treatments related to those diagnoses, healing, and then outcomes, right? But I would take it even further. I would say, you know, healthcare is um, finding the root cause of an issue and then addressing that and not just throwing a band-aid on the symptoms, right? And so Sometimes we'll encounter some sort of symptom that has come up due to maybe too much sugar, or whatever the symptom is, or some sort of autoimmune disease. But we only treat the symptom and not the actual root of the situation. And so I think healthcare includes that as well. Now, insurance, on the other hand, is none of that, right? So insurance is really just a financial tool, and it exists to transfer the risk of any type of, potential ailment or sickness from you directly over to a group or a body of people that then is there to pay for those medical needs as they come up, right? At least that's what we hope. And so, um, And so that's how insurance is structured, right? It's a financial tool designed to help with that risk. And so the distinction, I don't know about you guys, but I have seen some astonishing amounts of people are paying toward medical insurance right now, anywhere between $1,500 to $2,900 a month, which is absolutely crazy how much that people are spending on that care. And so that's a lot of money going out the door for a potential risk, right? And and what I'm hoping that this series will do is demonstrate that there are other alternatives out there that you can put your money into to help manage or mitigate that risk. And so the truth is that most people don't understand what they're getting, and um, insurance was never designed to make you healthy. It was designed to manage that financial exposure, right? It's also designed to protect the capital, right? So there's this body of money that's being collected, and the structure around that is designed to not let that money go, right? They want to keep as much of that money in house as possible. They want to reduce the risk of large, situations that might occur, and so that's part of the design of insurance. And you've probably seen, and what really frustrates me is when I see, on the news that an insurance company has made billions of dollars in profit at the end of the year. It baffles my mind how many people didn't get helped, and why did they not get helped, right? And it could be for a myriad of reasons, but it just doesn't seem right to me. So this whole problem started when we asked insurance companies to do this job, but then, but they never, but it was never the problem started when we asked insurance to do a job it was never meant to do. So we asked them to do this job, right? We asked them, say, okay, we'll pull the money together, do this job for us, but it never worked out, right? So we um, we invited it to get into the routine care world, into the preventive care world, into the everyday medicine, and so once that happened, medicine slowly stopped being about patients, right? Because I'm sure you've experienced this when you go to the doctor and the doctor's like, I got 15 minutes with you. Rush, rush, rush. You get 15 minutes. They don't even look at you. They don't even talk to you really. And then they're on to their next patient. I experienced this recently, and I made an appointment with the osteopath doctor. And I ended up, instead of getting the doctor, I got the nurse practitioner. And I actually wanted to speak with the doctor. And that's why I made the appointment, was to speak to the doctor. But I ended up getting his NP. And so I wasn't necessarily taken care of the way I wanted to be taken care of. So I'm actually on the hunt for a better doctor. I was somebody who will actually listen to me and take my questions and answer my questions, right? And so when insurance is in charge of your routine care or your preventive care or everyday medicine, you're not going to get the best service. You're not going to get the best quality um, solution that you need. The incentives are not there, or if it is, it's incentivized to keep you in the system. Oh, go see this professional, or go see this next professional, and you just keep going down the rabbit hole, and you never get an answer, right? So and so how we got here was basically originally insurance was designed for catastrophic, right? A specific catastrophic event. You paid for normal care out of pocket, but the insurance would step in if a big or rare event would come up, right? And so that's when insurance that's what it was supposed to be. This is pre-Obamacare. And so then things shifted, right? And then employers got involved, the government got involved, regulations started to pile up, And suddenly doctors stopped setting prices, patients stopped asking for prices, and in fact, I'm guilty of that. Back when I had insurance, I didn't care what it cost. I just knew I had insurance. And my copay was 25 or 50 bucks or whatever. And I paid that, and that's all I needed to worry about. The rest was taken care of by insurance. And so I abdicated that responsibility, it seems like. And then insurance companies started dictating the kind of care that we got. And of course, when the insurance company is involved, they're not going to dictate what's best for their patients because it's going to cost them more money. So why would they, dictate the best? And so then medicine became a lot of paperwork. And as you know, when you go to a provider, first thing they ask you is for your insurance card. They have a whole staff of people who deal with the insurance side of things so that they can get paid. They want to make sure they get paid for their services, and they'll bill everything and anything they could possibly bill to get that money. So, and that means that doctors became coders and that patients became policy numbers, right? And healthcare basically turned into a transactional situation, right? Or event. And the irony of that is that more insurance got involved, the less healthcare people actually received. And so, what are the consequences of that? The consequences really, it turns out that less, you know, um, that I had to get an MRI for my knee. This is the consequence. This is an exact example. I had to get an MRI for my knee. If I was to go through insurance or through the hospital, that MRI would have cost $3,000 to $5,000. Well, I found a place that would do it for 400, and I paid cash. And so why would I use the insurance? Why would I go to a hospital for that type of service? It's the same machine, the same operator and technician, all of that. But the difference is in how the financial system that I used, my cash dollars and my ability to negotiate or get a better price, that's the difference versus having insurance, right? And so I didn't need any prior authorizations to delay the care. I could get it anytime I wanted. I just scheduled it. Network restrictions, limiting the doctors that I could use. That's something that happens a lot with people. And then sometimes there's surprise bills with members. It's like, oh well, you didn't do this, and so now you got an extra bill. Um, and so none of that is healthcare, right? And so the financial bureaucracy is what is pretending to be the care, and it's not. Insurance didn't lower the costs; it basically hid the costs, and then when prices are hidden, this nobody becomes accountable to the system, and so it just balloons out of control, like a $3,000 MRI for something that would cost 400, right? And so we have to have a mental shift, right? Here's the shift I want to make. Starting as soon as possible. We instead of asking, what does my insurance cover? Because I hear that all the time. What does this cover? What does that cover? Well, we need to start asking, what does real healthcare look like? What are the pieces of the puzzle that I should have? And so in this website that I created, I've got like a primary care puzzle piece, got the catastrophic care puzzle piece, and then I've got some stuff for businesses. But it's really a two-part equation, right? And so part of it is, what do I do for routine, for emergency care, and for follow-up care, things like that. And then what do I do if I have a major medical situation where I need a lot of financial support? And so I've created some educational tools that are here for you. If you're interested, you can visit that website to learn more. But this whole process that I'm going to go through the next few weeks we're going to dive into some of the different pieces of the puzzle, right? And so these are very different questions when you ask, what does real healthcare look like? And so when you separate the money from the medicine and the care from the contracts, suddenly new opportunities and new options appear. And these are options that most people didn't even know existed, right? And so I'm on that bandwagon of like, I want more and more people to understand what health sharing is and understand what that's about. And we're going to talk about that next week. So I won't go into too much detail on that, but you can find out on my website what a health share is and why I think it's a better solution. And so this entire series is about clarity. I'm not here to hard sell. I don't like that idea. I you know don't necessarily. I'm not a fan of people who want to sell you a product that's going to benefit them more than it's going to benefit you. And so I'm from the nonprofit background. If it's not a good fit for you, I don't want you to have it. It's, don't bother with it. It's not. If you got something better out there, great. But this is, at least you should know, like, what is this about, right? And then no pressure, absolutely no pressure, whether it's a fit or not. Entirely, again, it's just an opportunity for you to learn. And so just understanding what, again, healthcare, what are the pieces of the puzzle that you need. And next week we'll talk about a model that does exactly that, right? The idea of a community-based approach that separates healthcare from insurance and puts responsibility and transparency back where they belong. And so you don't have to agree with it, and that's okay. I absolutely get it. But you do deserve to understand what it is, and then, if you know anybody who it might fit or do a better, be a better thing, solution for them, then you can always pass them to me or send them to What is Healthcare, or What is HealthShare. I have What is HealthShare.com as well. And so you can see that here on this website here, What is HealthShare.com. And I've got a really cool little true cost of healthcare. If you click on that, that will actually take you to a form and you can kind of get an idea. I think most people don't know what their annual costs are for their healthcare. And so this does a side by side comparison between their insurance costs and then what it would cost to be part of a health share membership as well. So there's something to look at, and I've got other resources coming. So, but to close up, I'd love to hear from you. I'd love to hear your response to a couple questions. What's the most confusing medical bill you've ever received? I'm curious to hear what you've seen. And then also, has insurance ever delayed care for you? And then lastly, and if you want, you can share this too. But do you think healthcare should be relational or more transactional? And that's kind of an obvious question. We'd love to have a better relationship with our doctors, right? And so we'll pick it up from there next week. And if nothing else, remember this: understanding healthcare changes everything, even if you never switch a thing. You just need to understand, how are you consuming that healthcare? Are you getting the best price? Are you asking about price? Are you getting the best service? And so forth. And so again, thanks for being here with me. Appreciate it. And I look forward to improving this setup that I have here, learning more, and being able to share more about these topics with you. And I hope you have a great rest of your week. And I look forward to seeing you in the future. All right. Well, again, thank you for your time. Here's the website, whatishealthshare.com. And if you have any questions, please reach out. You can find me there. Alrighty, take care. See you.